Hey everyone, Dr. Mark here with Davidson Chiropractic. Hope you're doing well. I've been having some patients come in complaining of some upper back and middle back discomfort, achiness, stiffness, tightness, you name it. Most likely due to them sitting at a desk for many hours, 6, 8, 12 hours straight, also driving back and forth from Lake Norman to Charlotte, spending a good 30 minutes one way at least, probably closer to an hour. So I want to give you a couple things that you can do to help improve range of motion in the thoracic spine or the mid-back area. So the first thing we're going to do is we're going to do a passive stretch using a foam roll. And if you don't have this, you can probably use a pillow. And we're going to lay on our side. I'm going to place the foam roll or my leg on the foam roll like such. This will keep my leg in good position in relation to my hip, so it won't be bent down, pulling on my hip joint. I'm going to take one hand here, one hand on top. If you need to, you can put a pillow underneath your head to kind of keep it nice and supported. And I'm going to take a deep breath in, and as I breathe in, I'm going to come open, and I'm going to try to get all the way to the other side. But I want to tighten my stomach and squeeze my downside butt because I don't want to arch my spine. And I'm going to hold here for about 2 breaths. Breathe in, exhale, hopefully letting the arm get a little further down on the opposing side. One more breath in. Exhale. Again, squeezing the belly and tightening the butt on that downside leg so you don't arch the spine. And we'll come back. And we repeat this sequence about 10 times on each side. Breathe in. Exhale. We're going to be targeting the thoracic spine. We're going to be putting a stretch on the chest muscles. We're going to be engaging the midline, activating the glute. So it's a good combination of active range of motion as well as some midline stabilization going on because you want to prevent that arching of the spine. So do that 10 times each side, at least once a day. The next movement we can do is more of an active range of motion, where if we can, we're going to get on all fours, then we're going to rock our hips back towards our heels. If we can get our butt to our heels, that's great. If not, we can come up a little bit. But if you can get here, this would be good. Then I'm going to take my hands outside my knees, and then I'm going to take a breath in. As I exhale, I'm going to look up towards my hand, rotating actively. Take another breath in. Exhale, try to move a little further. And maybe one more time. Breath in, exhale. And then slowly coming back. Then repeating to the other side. We want to perform 10 repetitions on each side. Do that at least once a day. These are some things to take into account. A lot of times we move when we're exercising. We're moving front to back when we're jogging. If we're lifting weights, it's usually in the frontal plane. But we don't do a lot of twisting. And the thoracic spine needs that time to actually work that range of motion so we don't get so stiff. And I see a lot of stiff mid-backs. When I'm working with people with whether it be low back complaints, what we find with the low back is sometimes they're lacking stability, but then the body compensates by having a very rigid, tough mid-back, the area between the shoulder blades. It's almost like trying to move or loosen up a brick. And so by doing these active ranges of motion and stretches, that we don't take into account all day long, this can help mobility quite a bit. So work on those. If you have questions, enter them in the YouTube comments or send us an email and subscribe to our channel. We'll talk to you soon. Take care.